Hi everyone, this is Sean with the Western Mass team of the MassSupport Network here with the Massachusetts Weekly Public Health Report for Friday, September 11th, 2020. So first, this is looking at the cases under quarantine. These are suspected cases in the state. This is how things looked last week. And here's how they are looking this week. There is a big drop there in the number of cases under quarantine. But let's talk about why that might be by looking at the next couple slides here. This is the cases that are confirmed cases. These are cases under isolation rather than quarantine. This is last week, and here's this week. So there's been a slight uptick in cases isolated and a drop in quarantines, and this is likely due to the increase in testing we've had recently, that we're just getting fewer and fewer of these suspected cases. People are able to get tested, so that means that people have to quarantine less, even if people have to isolate more, which means though that many people who might be quarantining in lieu of a test are getting tested and being able to go on with their lives. In looking at the hospitals across the state, there has been an uptick in new hospitalizations recently in the last week, but has also been some drop off in ICU cases and intubations. We may see if this is a real increase in the next couple of weeks, or if this is just where cases are so low at this point that there's just tend to be a fluctuation from day to day. But we will see about that. Looking at the age demographics in the last 2 weeks, still the average age of people being infected is 37, while hospitalizations are averaging at 59 years old, and the average age of death remains around 80 in the last 2 weeks. So this just shows who's being infected right now. So again, it is more younger people are being infected, but it's still older people who are getting sicker and dying. Looking at our contact tracing in the last week, things are holding steady, a slight uptick. I think about each percentage is about up 0.1% or 1 point in the last week. So we're reaching slightly more people across the state. And looking at how the state is doing town by town, this is how we were looking last time, and this is how we've been looking more recently. This is the data from August 23rd through September 5th, which is the most recent time we have this 2-week data on. So as you can see there, the eastern part of the state has low but still constant spread pretty consistently across the board there. Still some pockets around Springfield. Some new stuff in the Berkshires there. Looks like Williamstown and North Adams, but that's probably due to Williams College and Mass College of Liberal Arts, both coming back in person there and doing a lot of student testing. I know that Williams College has pledged to test all their students, but still a lot of community spread in the eastern part of the state. In terms of percent positivity, one last thing on that slide, our state incidence rate per 100,000 people per day has gone up another 0.4 in the last week. So there's a slight uptick in cases that way. Percent positivity, however, this is where we were last time, and here's where we are this week. And we have gone down again in percent positivity. The state rate is now less than 1%, which is awesome. That means we are getting enough tests out into the field there. Now, you can see here again, as usual, now it's the darkest 2 colors on the map, and even a lot of the third darkest, those are all places that are above the state averages there. Over just picking on Williamstown again, because I grew up there in the upper northwest corner of the state, you can see that where that had a significant uptick in the last 2 weeks in cases, the percent positivity is one of the lowest in the states because they are apparently just throwing the tests at college students over there. But the percent positivity going down while case numbers going up hopefully means that we are just catching every case that's out there. If we could somehow test every person in the state every day, our percent positivity would be microscopic. So the lower our positivity gets while the numbers are still going up should be technically a good thing. And to look at a little more, here is a graph of our percent positivity over the last 2 months and change. So what's interesting about this is it splits it into two factors. The lower darker line is the percent positivity total, and the upper line is the percent of individuals who are positive. Now, obviously, the upper line is factored into the lower line, and that's part of why the lower line is lower there. But this is because we're getting a lot of repeat testing, a lot of workplaces, especially places like long-term care. Workers are getting tested multiple times. So, someone may be caught, so if, say, you test 50 people in a facility, all of them are negative, you test them again, one of them is positive, it's, you're still only getting that one individual is positive, but you've done 99 tests that are negative. So that can account for some of that. Also, in keeping with the belief that I have that our higher numbers are coming from more testing at the moment rather than increased spread currently, is that roughly 20% of all COVID tests conducted in the state of Massachusetts were conducted in the last 2 weeks. And only 4% of our total cases were in that time, which I think is great news. However, there is some, it doesn't mean there's no, that we should just start ignoring safety precautions, because just looking at our R0, which is the rate of transmission, the reproduction number, when it is below, as we've talked about before, the R0 is a number that ranges from 0 up. It's the number of people that the average case will infect. When it's below 1, that means the disease is dying out in that area. And if it's significantly above 1, the disease is spreading. So this is just a graph from rt.live, which is a site that calculates reproduction numbers for the entire country. You can see here how Massachusetts, how our reproduction number dropped over the course of the summer here, popped up briefly in late June, early July, and is now above 1 for the first time in a little bit. That said, there is always a margin of error there. If you can see it on your screens, it's very faint. There is kind of a margin on either side of the line there, but we still need to be cautious, especially going into the fall with a lot of schools reopening. All right, one last thought to go into the weekend, just something that made me smile when I saw it earlier today. I thought of being careful this fall. Humpty Dumpty had a great fall, and there's a lot of great fall activities we can still do even with COVID. So there's still plenty of room to have a great fall and stay safe. And for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.